no, we can't do, but then, and then you have all these women in ACOG, like, knowing that ACOG is responsible for this, like, crisis that we're in of way too many cesarean sections and a maternal mortality rate that is a disgrace. Our U.S. maternal mortality rate is an absolutely disgusting disgrace. I'm embarrassed. They should be embarrassed. It's unacceptable. There's no excuse. It's unnecessary. And we're worried about, man, somebody might have, like, misgendered them and now they won't want to come in. Well, you know what? I'm really, like, concerned about whether or not this woman is prepared to be a mother. Period. VF, go ahead.
Oh my God, they started telling you about the violence that trans women face and not even mention.
You got your hand up.
Is my mic working?
Hello.
Yeah. Okay.
You hear me?
Well, they were bringing up.
Okay. Well,
you hear
put
me?
your hand back up if you want to, or you're just turning it down. I don't know.
I don't know.
All right, sorry.
My
Kiki, one more
mic.
thing. We'll just. Sorry, I'm like going off the rails here. Let me just finish this and then you can talk.
Aims at making people's practices trans friendly. You call it. What's the top piece of advice that you give your peers for that?
One of the biggest pieces of advice I give, and where I've spent a lot of my energy, is in training my staff. So I work at a women's hospital, and so we don't have a med-surg floor that has both male and female patients, and so we had to do a lot of education, helping the nursing staff, helping even all the way down to your admitting, your dietary staff, making people understand why this patient might be coming to your hospital. And so doing that work at the hospital level so that when your patients are there for surgery, they're comfortable. But in the office, it's so important that even the very first person this patient has contact with knows and has some training and feels comfortable themselves. Making your office staff feel that they can approach you and ask you questions, that they're not going to be judged for things they might not know, and then giving them the tools and empowering them to take good care of patients.
So what else do you want your colleagues to know about this topic? Is there something we haven't addressed?
I think the most important thing is, in caring for transgender patients, you're caring for a patient. And so paying attention to who's in your office, why they're there, and knowing that they're a patient just like any other woman that might come into your office for whether it's OB care, GYN care. They have a lot of the same issues and complaints. And it's just making sure you don't, even if you mess up and you goof up using the wrong pronoun or using the wrong name, apologizing and moving on and kind of owning that you're just providing the same care that you provide to any other patient.
All right, Dr. Beth Cronin, thank you so much.
So, Kiki, before I move on to you, and I'm going to let you speak, but you got to understand, this is why now we've shifted to pregnant persons, and because, there's this walking on eggshells. And again, remember the whole, the history of the whole trans thing and how it sort of rooted itself in popular culture. The alarm that was originally set off that made us all go, oh God, I guess we need to go along with this, is if you don't do it, they're going to kill themselves. Which anybody who has any, experience with narcissistic abuse knows that is such a typical manipulation tactic. If you don't take me back, babe, I'm going to kill myself. I can't live without you. Never mind that I've been hitting on you for the past 3 months. Never mind that I degrade you and treat you like crap, and I've stolen from you, and I wreck your things, and I control you. But you finally got the strength to break up with me, and now if you don't take me back or listen to me, I'm going to kill myself. It's control. Kiki, go ahead.
Yeah, so what I was thinking about during all of this, so recently, well, not recently, but everybody knows Exelancet covers certain accidental seahorses and stuff like that. And in my video, when I kind of react to that, I just say straight up my honest opinion, which is she should have gotten an abortion. If you are gender dysphoric but pregnant, that's the most female thing that you can do, and it is the most selfish thing to do to continue your testosterone. It just doesn't jive, right? It's like, how can you be dysphoric but you're doing the most female thing? Like, you should actually want an abortion. You should want your uterus out, because this is so female. It's exclusively female. The fact that you are pregnant and the fact that you had penis and vagina sex and got pregnant, it's the most female thing. And I think I just wanted to kind of mention that little ditty. But the other thing that I was thinking about at the very beginning was my mom's birthing stories, and just how she talked about her male OB. She had to tell my dad, like, do not let him talk me into anything. I want a natural birth. Don't let him do anything. Because that was with me, but with my sister, who was born first, the reason she was so hard up about that is because the OB for my sister's birth was a little pushy, and I think we all know that male OBs can be problematic. And my mom had natural births and stuff, but she talked about how they kept trying to make her lay down on her back, and she was like, no, I need to stand, I need to sway, I need to, and like Brittany was saying, the moaning and stuff, it helps with the pain, and with, the vibrations help with the physical pain. And so my mom was like, no, I'm going to stand up, and I'm going to sway, and I'm going to moan, and I'm going to just push this baby out. And that's how I was born, as she was standing up and they were under her. And so that, she had this natural inclination of like, this is how I'm supposed to be having a baby, not, on some table with my legs up and a bunch of male doctors telling me what to do and telling me what I need. We have been just so far removed from our natural selves, from the connection of ourselves with our own bodies. And, the midwife thing just keeps it more natural. Home births, keep it more natural. And then you don't have the male influence of, can we just get this lady out of here so that I can go on to drive my cool Jaguar and go somewhere to my second home. But that was pretty much it.
Excellent comment. Excellent comment. And again, and I want to be so clear. When we talk about, natural birth versus a birth that, required interventions, like, please understand, some pregnancies do and will require intervention. And that is absolutely okay. And it needs to be, but again, we've got to come with absolute reverence and recognize that just like a developing body of an adolescent child, once you disrupt one piece of that, vastly intricate network of biology, you risk a cascade effect where then another thing gets fucked up and another thing and another thing, and it all starts to fall apart. You need to be so sure that that risk-benefit analysis is on point and do the best to have the most little interference possible. And you're absolutely right. And it's like, is that even possible in some of these environments? And now, again, it's like we've gotten so, well, as Kiki, as you just said, we've gotten so removed from our bodies. And that's how this trans thing even was able to take root, because the further away, once we took birth out of the homes, we children never learned the true sexual life cycle of being a woman, right? Children, some children are blown away when they see a mother breastfeeding, because it's like, well, what is she doing? Why is she putting her boot? Ew, because again, breasts have become the primary function now for, the sexual enjoyment of men. And some children grow up not even realizing that no, they have a purpose, and it's not just for jamming them up in a bra and posting pictures, but they nourish children. The further away, it's been a long process unfolding to where we are now. This didn't happen. We say it feels like it happened overnight, this trans thing. It feels like we went from 0 to 100, but the fact of the matter is this has been a long process of slowly pulling ourselves away from our experiences. And there are absolutely a time and a place for things like epidurals. Sometimes they can prevent a woman who is so exhausted and so frozen up and maybe feels like she's unable to continue. That could sometimes give her the reprieve that she needs to go on to finish birthing her baby. But we need to be careful with that too. We have women become so over medicated. Someone said like the thalidomide. We've been experimenting on bodies of women that again, unfortunately, giving drugs in labor changes the way that your body is able to experience its hormonal functioning. And that can change the way that we bond and we connect with our experiences. And so, not that there's not a time and place for these things, but it cannot be routine. We cannot just see this as a conveyor belt. So, yeah. So, does anybody else have another comment before I keep reading the rest of? All right, hold on. Give me 1 second. Sorry. I ran outside for a second. I get all worked up and I start doing laps around the house. I can't sit still. Here we go. All right. So yeah. So anyway, they clarified for us what they meant by barriers of care, and it was about language. And if a trans man needs to come and get his cervix screened, and you're calling him a woman, you know what I mean? Why don't we deal with the fact why are they so disconnected from their body? Yeah. Okay. You guys know I'm fucking preaching to the choir here. But here we go. All right. So, okay. All right. So the committee opinion offers guidance on providing inclusive and affirming care, as well as clinical information on hormone therapy and preventative care. It also cites existing resources for those seeking information on the care of transgender adolescents. The social, and also I'm still really confused when they talked about, for trans women. Again, why are we forcing trans-identified males onto these practitioners? What are they supposed to do? What go and help you dilate? Go look at the wound that you've created when you inverted your penis. I'm really confused about that. It's not appropriate. Period. It's absolutely not appropriate. It's not appropriate for pregnant women to go sit and then have a man who's dressed in woman face because, he has sexual arousal from, dressing up that way, to have to go sit in a room. I mean, it's ridiculous. Okay. It also cites existing resources for those seeking information on the care of transgender adolescents. The social and economic marginalization of transgender individuals is widespread. Is it? Is it really? Which leads to healthcare inequities and poor health outcomes for this population. To reduce the inequities experienced by the transgender community, the provision of inclusive healthcare is essential. It's really funny to me how inclusive healthcare tends to cause the exclusion of women. So all this inclusive language always seems to somehow kick women out of, their own words used to describe themselves and their own experiences. So how inclusive is it really? Obstetrician gynecologists should strive to make their offices to and inclusive for all individuals and should seek out education to address healthcare disparities, both in their individual practices and in the larger healthcare system. In order to provide the best care for patients, it is useful to know which healthcare professionals to include in a referral network for primary care and have many clinician and surgeon options given to the many different therapies available and the different sites at which these therapies are offered. It is so basically it's now, in order to provide the best care for patients, yeah, so now they're placing the onus on obstetrician and gynecologists who should be spending their time, their attention, their practice on, developing the best standards of care and protocol for pregnant and birthing women are now being told that they need to be prepared to help guide some gender confused person on how to transition and where to go and who they, bro, what? No, that's not what they should be focusing on. I mean, my God, we don't have time for this. Like I said, our maternal mortality rate is so grotesque in this nation that we don't have a fucking second to spare on anything other than resolving why Black women are dying at insane rates. And that's not some woke bullshit. That's real. That's definable. That's verifiable. I've seen it myself. I've had to care for women. I've had to care for poor Spanish-speaking women, poor Black women. I've seen the difference in the care than my private white clients. It's terrifying. It's fucking terrifying. So no, we don't have a second to spare on any of this, externalities. It's insane and it's scary, and uh we have way too much to do. Way too much to do. And then what are we going to add now to the specialty, trying to help, these OBGYNs how to, assess an inverted penis? Go ahead, hand up.
Yeah. Sorry. First of all, I'm a man. I know I'm a man. Am I able to speak in this space, or is it just for women?
Hey, Brittany, can you hear me okay?
Oh, hello.
Oh, sorry. Yeah, sorry, Christina. Just he's gonna say something, and then you're next.
Oh,
Okay,
okay.
sorry. Go ahead. Go ahead. Yeah.
Sorry.
No, of course.
Okay. Cool. Yeah. I mean, I'm a black man. I'm gay. Um, I have two older sisters, and what you're saying is just so painful. I mean, my sister, she had a miscarriage a few years ago as a middle-aged black woman, and the idea that healthcare and women's needs is being lost because men are coming in and declaring themselves women, and it's confused, and it's completely muddying women's healthcare by introducing men's healthcare into women's healthcare, whereas we know already that medical research, the whole, whether that's drugs or anything across the board, it's already designed for men. So I don't, and then when I raise this with so-called transgender people, with gay men, with self-obsessed narcissistic gay men who were narcissists long before the transgender nonsense came along, it's a known element of look at me narcissism that exists within that community. The idea that they are now stepping on women like my sister, like my mother, it's just insane. And I think that we can broaden the church. I think that we can reach out to people like me, go way beyond women and say, this is not acceptable. Yeah, just wanted to say that. What you said really, really hit me. Because, yeah, the stats are insane. It's insane.
It is. Thank you. And listen, I listen, like, and I know that some people have different views. I personally feel that men not only should but need to be a part of the conversation. Again, it's like the family unit. It includes all of us. And men should care and be concerned. And when it comes to the needs of women, women should lead and show. I mean, what it is that we need. And I've said that the transgender movement, it does two things. It's either destroying a female body. In the case of a trans-identified female, it's about destroying your femaleness, or in the other way, a trans-identified male colonizing femaleness and redefining it. Either way, it's destroying, what we know as women. But Christina, go ahead.
Well, I was just going to add that, like, we should definitely have Dr. Veerling on to talk about this, um, and about how this ideology really turns women's bodies into a profit machine. Like, did you know that they sell your umbilical cord, and apparently it's worth like thousands and thousands of dollars when your baby's born, and they don't tell you they're going to do it, but it's like hundreds of thousands of dollars. Dr. Veerling told us the number at Icons, and I can't remember the exact number, but it's a lot. And like, women who have abortions, they're selling that fetal tissue too. They're profiting off of that. And you got to wonder then, what are they doing to these women that they're removing their body parts, taking out the uterus and fallopian tubes and all these bits and pieces? How much money are they making off of this? And it's really dehumanizing It's about profit. It's about turning a woman's body into a factory, or into a profit machine. You know, um, it really infuriates me that the organization that's supposed to, like, the medical organization that's supposed to focus on women's health is now going to include men and gender confused women. Like, they are women. You know what I mean? Like, it's absolutely ridiculous. Anyway, that's all.
Yeah, no, thank you, Christina. You're right. And what scares me too, and we've seen recently on TikTok, we had this trans identified male who is demanding, complaining that his local OBGYN said that they were, referred him out. And they're like, no, we can't care for you. We care for, the bodies of women. We're not, qualified, as you can read in this ACOG, again, the American College of Obstetrician Gynecologists, who sets the standard of care, is saying the onus is now on practitioners to learn about resources for transgender individuals and help them get, whichever transitioning needs that they might want to have met. And it's now broadening. We already have such a lack of qualified people in the birth world. You know what I mean? We need more doctors. We have Black women dying. I will say it fucking 1,000 times. I'll say it till I'm blue in the face. And again, this is based on statistics. This isn't based on some sort of like woke, just whatever, virtue signaling. No, it is factual. There's not many, no, I mean, there's really not many people who would be able to refute. Black women are dying in childbirth at insane rates. And that is even when you solve for education, for, some people go, oh, well, maybe are we talking about, women who are from, bad areas, who maybe don't have access to good nutrition and things. No, even when you're solving for women who are highly educated, who come from high income backgrounds, who, everything else being equal, they are dying at absurd rates. As the mother of a biracial daughter, it's not acceptable. As a human being, it's not acceptable. As a woman, it's not acceptable. As a birth worker, it's not acceptable. And until we've resolved that, I don't want to hear anything about, somebody's pronouns or how we can accommodate, somebody's delusion. And clearly, ACOG has already opened the door and has made it clear that the expectation now is that obstetrician gynecologists now have a responsibility to kind of participate in the transition. And what, like I said, I'll say it again, what the fuck do they have to do with trans identified males? Why would a trans woman need to walk into an obstetrician gynecologist unless they were an autogynephile who has a specific fetish in the bodily functions of women, and it's exciting and thrilling for them to go lay down, put their feet in stirrups with a gown on, and have a doctor fondle their genitals? I can't see another reason. And how dare you? How absolutely dare you put young women who are trying to take back obstetrics as a more female dominated, which we know it was founded by men, it was created by men. I really believe it needs to be razed to the ground, and we need to take birth back and rebuild. But I mean, for the women who are doing their best to work in the pre-established system and to bring back a female centered, we can't even say woman centered anymore. It's birthing people. It's scary. And let's continue. Did anyone else have a comment? All right. Yeah. So, and when we are spending more money per capita on every child born, yet we have the worst birth outcomes in the developed world, we don't have time. This is actual life and death, not the sort of life and death of, misgendering someone is violence, and again, they don't want to come in for care now because you misgendered them and they're not feeling, welcome. No, fuck that. I've seen women who will walk barefoot 15 miles on rocks and glass to get care because it's that serious to them, because it matters that much. You think she gives a shit about some little formality? No, she's doing whatever she can to create a healthy start for her children. That's a barrier to care. Not because somebody won't, sit there and pander to your delusion. And I say this too, and please, anybody in your lives who is, pregnant or planning to become pregnant somewhere in the perinatal process, if they go to a birth professional on any level, whether it's a lactation specialist, a birth doula, a birthing coach, anybody who panders to gender ideology at any level, if they cannot define what a woman is, if they're, talking about preferred pronouns, you run. They are not fit to serve, period. They are not fit to serve. If they can't even properly describe the women whose care that they are asking to be entrusted with, they have no business anywhere. A birthing woman or a pregnant woman, get the hell out of there and get out of there fast. All right. Let's see. So to reduce the inequities experienced by the transgender community, again, we're reading from ACOG's. This is their most recent clinical bulletin on transgender care. And again, as I said, it is so important. I'm planning a protest of the American College of Obstetrician Gynecologists. It is important that we know our enemy. We must know everything. That we cannot make assumptions. We need to know. We need to be able to refer to this stuff. So let's go through the bulletin. To reduce the inequities experienced by the transgender community, the provision of inclusive healthcare is essential. Obstetrician gynecologists should strive to make their offices open to and inclusive for all individuals and should seek out education to address healthcare disparities, both in their individual practices and in the larger healthcare system. So let's read that again. The provision of inclusive health, or let's see, obstetrician gynecologists should strive to make their offices open and inclusive for all individuals. They give no caveat. It wasn't like, all kinds of women, all kinds of families, or, women from different socioeconomic backgrounds, women from different racial and religious backgrounds. No, all individuals, period. There was not like, there was no clarification. So you're telling me that creepy, Dale from up the road, can he come in and get a prostate exam because it's thrilling to him? And what these young doctors and physicians who no longer own their practices anymore because all their practices have been bought out by these big parent companies who are now telling them what they can and can't do. They can't even practice the way that they want to practice. That's why do you think we're losing so many physicians? They're not allowed to really practice. It's medicine is no longer an art. It's an art and a science where you're having to tailor your care to the specific needs and use your own judgment. No, they're giving you these formulas, and if you don't follow them, you're out. You're out. And it's a terrible way to practice. You have your hands tied and saying that you just have to accept any trans-identified male who comes in and wants you to finger his neo-vagina for a little while. You just got to sit there and take it. Fuck no. It's absolutely time to push back. And like I said, it's getting pushed, at OBGYN's healthcare has been absolutely overrun by gender ideology. It is long overdue that we stand up to this. Let's see. In order to provide, to reduce, they should seek out education to address healthcare disparities, which that tells me right there is now they're going to make continuing education requirements where OBGYNs are being forced to learn about this pseudo, science nonsense, this unscientific gender crap. So they're basically, it's re-education. It's like the re-education camps. It's the indoctrination camps. So they're basically saying they're all gonna have to be indoctrinated. Let's see. So blah, 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 blah. Both in their, okay. In order to provide the best care for patients, it is useful to know which healthcare professionals to include in a referral network for primary care Oh yeah, I said that. And have many clinician and surgeon options given the many different therapies available and the different sites at which these therapies are offered. So again, OBGYNs now have to learn about which trans care they can refer to. Like, no, let them focus on what we need to focus on, which is the fact that we have an overly technocratic birth environment where, we're overusing surgery, we're cutting open the bodies of women. We have an absolute crisis of postpartum depression because we've ripped away the support networks for women. We're destroying their birth experience, leaving them traumatized, totally disconnected. We've interrupted the essential biochemical processes that allow us to properly transition into motherhood and bond with our babies, and breastfeed. We've disrupted it, fucked it up, cut up their bodies, and then we say, here, take your baby and go home. Your husband doesn't get any time off, but boy, you get a nice 6 weeks. Now, we're not going to pay you, but your job, as long as it employs more than 200 people, has got to hold your job for you. Then you take that newborn and you go dump them in the daycare so you can afford to keep living. And we wonder why women are falling apart. We wonder why women are drowning their babies and killing themselves. We're getting fucked up on fentanyl. And then it's, these moms are just selfish these days. They have no access to their families, no access to a system of mothers and sisters. When women were giving birth in true female supported environments, you had access to your midwife. You were surrounded by your sisters who lived in your community, your mothers who lived in your community, if not in your own home, your neighbors. I mean, you had a whole network of women to lean on. Now we're telling, go take care of your wife and go back to work and somehow figure out how to help support her with things that you clearly don't understand, that she doesn't even understand. She's she's hacked up, can barely stand up straight, and is forced to now do everything and just get back to life. But no, we're fucking worried about someone's pronouns. Give me a goddamn break. Let's see. It really makes me mad, you guys. It really does. It's really emotional. All right. So let's see. Waste a bunch of OBGYN's time doing crap that they shouldn't have to do. Got it. All right. It is important to remember that although hormone therapy is medically necessary treatment, once again, I will never take anything ACOG says seriously with this unscientific shit. Where's the citation for that statement? I mean, it's not even, again, we don't have the long-term cohorts for this. It literally says, it is important to remember that although hormone therapy is a medically necessary treatment for many transgender individuals with gender dysphoria. Not all transgender patients experience gender dysphoria. What? And not everyone desires hormone treatment. Not all transgender patients experience gender dysphoria. Again, this is just to leave it open so it's really like anything goes. Nothing means anything. It's, and you don't question, you just gotta go like, bro, what? Sexually active individuals with retained gonads who do not wish to become pregnant or cause pregnancy in others. And again, because of all this, like, gender neutral, we have to have all this confusing language and stuff. And we wonder why all these young, autistic, young girls who think that they're boys are popping up pregnant because, again, they're being told that they're literally boys. And we're lying to them about sex and human anatomy and how reproduction works. And then we wonder, oh, wow, yeah, when they're popping up pregnant and they have no idea why or how they got there because you told them that they were a boy. Sexually active individuals with retained gonads who do not wish to become pregnant or cause pregnancy in others should be counseled about the possibility of pregnancy if they are having sexual activity that involves sperm and oocytes, which is ovum, which is, eggs. So, oh my God. Let's make this as confusing as possible. Although being knowledgeable about the medications used for the gender transition and potential risks and side effects is important, specific certification for prescribing them is not required and should not be a limiting factor in helping patients access care. Well, there you have it, folks. The little quick nod to the fact that there might be some real damage being done here. There's some potential danger, but don't think too hard. I'm going to read that again. Although being knowledgeable about the medications used for gender transition and potential risks and side effects is important, it's like a but. Anything you say after like the but, it's like it totally negates everything you just said. Specific certification for prescribing them is not required and should not be a limiting factor in helping patients access care, which means while it would be great if you knew some of the downsides, it's best that you don't look too far into it and go ahead and prescribe the cross-sex hormone, even though we know exogenous testosterone can have catastrophic, deleterious effects on the development of the fetus, on the mother, the ability to properly birth, and then later bond and breastfeed. We know that it causes spontaneous miscarriage. We know these things. We know that children born to mothers with PCOS, polycystic ovarian syndrome, wherein the mother has too much testosterone in their system, we know that they are at increased risk for coronal defects. We know that they're at an increase, which is heart defects. They're at increased risk for diabetes related diseases. And there's so many more things that we don't fully understand. We know that they're at risk for low birth weight, which can be absolutely devastating to a neonate, to be born too early and too small, to have not had the proper development, and can lead to hospitalization, can lead to, decreased cognitive function. We know these things. How dare you gloss over, there might be some problems with it, but don't let that hold you back from, just go ahead and luckily for you, we've made sure that there is no certification necessary. None. Meanwhile, oh my God, it makes me want to gouge my eyeballs out. All right, anyway. All right, recommendations and conclusions. The American College of Obstetrician Gynecologists makes the following conclusions and recommendations regarding health care for transgender and gender diverse individuals. Let's see. Oh, wait, hold on. Oh, yeah, okay, sorry. The American College of Obstetrician Gynecologists opposes discrimination on the basis of gender identity, urges public and private health insurance plans to cover necessary services for individuals with gender dysphoria, and advocates for the inclusive, thoughtful, and affirming care for transgender individuals. Hey, ACOG, you know what would really be great? Maybe rather than worrying about that, making sure that, insurance plans cover for things like, I don't know, breast implants for grown men. How about you worry about the fact that diastasis recti, the condition wherein women who are mostly multiparous women who have given birth and to multiple children, whose stomach muscles never fully healed back together, can literally be a crippling condition wherein otherwise healthy women, and no matter what they do in the gym, can never get those muscles to heal back together. And now their core strength is wrecked to the point where it's difficult for them to even stand properly, to run, to have a full range of motion. But now they have a bunch of little kids to care for, but they can't even fully function in their bodies. But guess why we can't get that covered? Because an abdominoplasty is considered a cosmetic surgery. And because, it could be seen as a cosmetic surgery, it is never, ever covered. Never mind the fact that it literally can cause women to become disabled But no, some people might use it for cosmetic surgery. So, but no, let's make sure that the 35-year-old, like porn addict gets his breast implants covered. How dare you? Like, how dare you? All right. Here we go. Obstetrician gynecologists should make their offices inclusive, inviting to all individuals who need obstetric or gynecologic health care. Well, hold on. So who need obstetric, but imagine an OBGYN telling some man that he doesn't need it. Let's find out how that turns out. They should take steps to educate themselves and their medical teams about appropriate language and the healthcare needs of transgender patients. They don't have time. They don't have time. We have women dying in childbirth every day. They don't have time. They need to solve the first and foremost issues before we get off into this make-believe land. Next, it says fertility and parenting desires should be discussed early in the process of transition before the initiation of hormone therapy or gender affirmation surgery. From my experience, and I was diagnosed with squamous cell carcinoma, aka cancer, in 2021, April of 2021. And I can tell you, it is very difficult. Something like cancer care requires, collaboration with a variety of doctors across many specialties. And even in the most I had a pretty straightforward type of cancer. Even in the most like well-established cancer centers, it is very difficult to kind of figure out, well, who's most responsible for what. And there's always miscommunication between the doctors, and sometimes they would ask me who was supposed to be in charge of this area of my care. I was like, how the fuck am I supposed to know? What are you talking about? Why are you asking me? you know and so I can only imagine. It's like you get all these different doctors between the therapist and the counselor and the endocrinologist and the surgeon and now the OBGYN and all these different people who are supposedly responsible for transgender care, and they're all just being told like, oh yeah, just affirm and whatever. Who's responsible? Who ends up? It's kind of like the tragedy of the commons, where it's like no one thinks it's really their responsibility. Well, somebody else must have raised those issues with you. Oh, well, you've already gotten the therapist to sign off. I'm sure they talked about it with you. Or the surgeon must have been the one. And it's like everybody bucks the responsibility and it never even happens. And your only job is not to make sure that they're safe, but just make sure they're affirmed above all else. And you just said before that it literally said, as we read, ACOG said that people can still get pregnant after transitioning. They never even gave a caveat of like, unless you fully transition. So you're literally telling women, oh, you can still get pregnant after transitioning. They're like, great. So they go and get a phalloplasty. And then later when they find out, oh no, you removed your uterus, you can't have a baby. And it might sound silly to us, silly to any of us who were educated prior to 2015. It's like, well, of course they would know. No, I think we can't assume that young people are going to understand that a uterus is a pretty vital organ in reproduction, because we're lying to children at such insane rates. We're lying to young people. We're being totally dishonest and disingenuous about how this stuff works. We can't just assume anything anymore, that they'll understand how anything happens. So they might have their uterus taken out, their breasts removed, and then later be devastated to find out that no, you can't breastfeed, and no, you can't carry a child to term. What? Well, but what do you mean? Yeah. So, too bad. But hey, we affirmed you, right? That's the most important thing. Another life saved, suicide prevented. The majority of medications used for gender transition are common and can be safely prescribed by a wide variety of healthcare professionals with appropriate training and education. Whoa, 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 whoa. I thought didn't they just say that certification is not required? So what do you mean with appropriate training and education? Because you literally just said that none is required. None is required to prescribe this stuff. And it's best that, you just go along and help them, whatever, including but not limited to obstetrician gynecologists, family or internal medicine physicians, endocrinologists, advanced practice clinicians, and psychiatrists. Hysterectomy with or without bilateral salpingo-oophorectomy. which is a hysterectomy, like with or without having the, sometimes like with a hysterectomy, if you can safely retain the ovaries, it's best because then it doesn't throw you into immediate iatrogenic menopause. Um, but let's see, hysterectomy with or without bilateral salpingo-oophorectomy is medically necessary for patients with gender dysphoria who desire this procedure. Is okay, so a hysterectomy, the removal of one's uterus. But didn't you just say that patients can still get pregnant even after they've transitioned? But now I'm so confused. You acknowledge that part of transitioning for some patients is a hysterectomy, which is the removal of the uterus, with or without oophorectomy, which is the removal of the ovaries. What are you talking about? And that's really the thing. That's something they're peddling to children, okay? In Chicago, or I'm sorry, Boston Children's Hospital literally had a promotional video touting their ability and willingness and availability of pediatric hysterectomies, which means removing the uterus of children. Why that would ever be necessary, I cannot understand. I cannot fathom. Okay, it's enraging. It's disgusting, and the fact that they're going along with this to guide preventative medical care. Any anatomical structure present that warrants screening should be screened gender regardless of gender identity. Now that I can get down with. That might be the only thing that this is said that I can get down with. Yes. Young women who are trying to present as male should still get screenings. And how do we assume that they'll understand that? Because now you're telling them that they're literally a boy, they're literally male. They're not going to be reading recommendations for young women. They're not, you know what I mean? And then what about these doctors who feel like, oh, well, we have to treat them as men. So which is it? Do you have to actually give them male recommendations for male health? This is why this is dangerous and insane, and it starts to go down at every level. And we have major medical associations who are responsible for creating the standards of care and writing guidelines, who are comfortable with totally just destroying any logic or basis of reality in giving these standards of care. This should be terrifying to every single person. When I say that this is a medical scandal that is of the most heinous that we've seen probably in modern history since the Nazis, I mean every word of it. It's up there with thalidomide. But even worse because it's like it's at every level. It's at every level. So let's see. All right. And then real quick, they give a background. Transgender and gender diverse individuals face harassment, discrimination, and rejection within society. Lack of awareness, knowledge, and sensitivity, as well as bias from healthcare professionals, leads. So they're worried about bias, but we're still haven't worried about racism in maternity care that's actually killing Black women, that we know is actually killing Black women and babies. But let's skip right over that and head straight to the guy in the dress or the girl who for whatever reason got sucked into a rapid onset gender dysphoria craze, which leads to inadequate access to, underuse of, and inequities within the healthcare system for transgender patients. And again, they say that the main root of that is because people get turned off from accessing care because they're not called the right pronouns. Again, it's the narcissism. It precludes everything in this movement. Throughout this document, the term transgender will be used to refer to anyone who identifies as transgender, gender diverse, and genderqueer, while acknowledging that there are vast individual differences and variations of preferred terminology. Yeah, you'll never be right. That's another thing you all need to realize. You'll never be right because once it becomes mainstream, it's not exciting anymore. It doesn't get the attention that it once did, and they're going to have to evolve again. For related terminology definitions, this committee opinion provides guidance for obstetrician gynecologists on both routine screening and transition care. There it is, folks. There it is, folks. This committee opinion provides guidance for obstetrician gynecologists on both routine screening and transition care. So they are laying the groundwork for requiring OBGYNs to sit there and have to interface with the destroyed penis of a mentally ill, porn sick man. Now they have to include these men and their wounds for care and try to deal with the fallout from this horrible medical experimentation that is, in every case possible, going terribly, terribly wrong. How dare you? I mean, there needs to be a revolt. Any OBGYN, and luckily listen, I have a very good friend who is like an amazing OBGYN. She is trained OBGYN. She has a specialty in like post-cancer care, so like reconstruction and things like that. She's like so brilliant. She married a good friend of mine from high school, and I got close with her. I'm proud to say that I have participated in peaking her. And I know that she does a lot of professional stuff. And I'm wondering if I could get her on like anonymously so we could really get some insight onto what's going on. She used to be totally, with all this lefty, all that kind of stuff. But I know for a fact that there's so many things that she didn't fully understand. And now that it's been brought to her attention, she's like, oh my God, I can't support this. I think everybody needs to just revolt. Obstetrician gynecologists should be aware of the unique needs of transgender individuals and be prepared to assist them with preventative health care. How are they supposed to know? We don't know what the fallout's going to be from all these weird surgeries. I mean, surgeons are making up the procedures as they go along. There's no, protocol. There's such a wide variety of how they're trying to accomplish these aesthetic things. And we know that, I mean, it's going to be a crisis for when these people age and have to go into care homes, and no one's going to know how to take care of them. They should be, OBGYN should be aware of the unique needs of transgender individuals and be prepared to assist them with preventative health care, as well as knowledge of hormone and surgical therapies. Why the fuck is that an OBGYN's responsibility? The American College of Obstetrician Gynecologists opposes discrimination on the basis of gender identity. So basically, they have to take in any man who wants to, indulge his fetish and use you as a prop for doing so. And you're not allowed to say no. Got it. Urges public and private health insurance plans to cover necessary services for individuals with gender dysphoria and advocates for inclusive, thoughtful, and affirming care for transgender individuals. Here's another question. What about actual women who, don't feel feminine because, they never really developed a lot of breast tissue? What about their gender affirmation? Should we be getting out breast implants for everybody? No, because we say, oh, well, women come in a wide variety of bodies and they're all beautiful and we should celebrate those differences and stuff. But as soon as it's a man who wants some tits, well, get him on in and pay for it top dollar. And he's locked up for raping and killing a bunch of women. Well, put him first in line. Okay. Again, women with severe diastasis recti, it doesn't matter, which again, it's the abdominal wall that never fully, came back together. It's all pulled apart. Women who have, a bunch of hernias and things like that, could barely stand up straight and care for their families, who are desperately needing an abdominoplasty, but no, they can't have it because, well, it might give you a smaller waistline. It's too close to a cosmetic surgery. Never mind that you can barely move anymore. Where is the guideline on that? OBG, ACOG? Why aren't you talking about any of the stuff that actually matters to real women? No, let's just gloss over that. I'm sorry, but above all, deal with the black maternity mortality rate fucking first and foremost. And then deal with the fact that we have the worst maternal mortality rate in the developed world. Period. I mean, it's oh God, it's like first world bullshit to like the max. All right, the American College of Obstetrician Gynecologists, blah, blah, blah. Okay, blah. Opposes discrimination on the basis of gender identity, urges public and private health insurance plans to cover necessary services for individuals with gender dysphoria, and advocates for the inclusive, thoughtful, affirming care for transgender individuals. And as we all know, inclusive care for transgender individuals always turns into exclusionary language and exclusionary care when it comes to women. Women are the first to be pushed out when we decide to be inclusive of all. Although there is some overlap in clinical and psychosocial care for adolescents and adults, there are some issues specific to adolescents. The American College of Obstetrician Gynecologists supports the provision of appropriate and evidence-based care for transgender and gender-diverse adolescents. For guidance on the medical and surgical care of transgender adolescents, see the World Professional Association for Transgender Health, the Endocrine Society, and Pediatric Endocrine Society. Wow. Well, Endocrine Society of all should absolutely be opposed to this. So, yeah, so there's more, and they have like an index. I'm going to do another space, and we'll go even further into that. But this is why it's so important, because again, this is setting the standard of care. And if we continue to go in this direction, it sounds like they're laying the groundwork for requiring that that OBGYNs either perform some of these transition surgeries or take a much larger role, to the point where there might be some OBGYNs where their only role is dealing with, gender affirming care and, dealing with the genitalia, the mutilated genitalia of trans people and things like that. And we will have less and less and less access to the expert care in things that we need to safely bring our babies earthside, to safely carry children to term. Knowing that our food is more and more poisonous, that so many of the things that we needed to be safe and to develop healthy families, we've destroyed the family unit. We're ripping apart. We've made it impossible for families to survive off one income. We're one of the only developed nations that has no maternity leave. Literally. Except recently they made it, and this is, a lot of women, when I was in the birth world, had really pushed for this. The legislation, the affordable, or the, what is it, the Family Care Act or whatever it was. If you employ over 200 people, then you're required to give 6 weeks of leave, but it's not paid. So they'll hold your job for 6 weeks. Anyone who's had a baby, 6 weeks, you're just finally getting out of bed by then, especially if you've, had to have surgeries, a surgical intervention. It's horrifying. We wonder why children aren't properly bonding, why they're having, and then we wonder why once they hit school, there's all these issues. It just cascades further and further. And these are probably a lot of kids who end up saying that they're trans because they feel disconnected from their own bodies. Women who barely were even participant in their own births. It's, oh my God, it's fucking scary. So anyway. On November 3rd, we will be targeting the American College of Obstetrician Gynecologists. They need to be called out. They need to be exposed. They need to be put on blast. They need to answer. And the demand is very simple. Either the American College of Obstetrician Gynecologists either divest itself from gender ideology, or else U.S. medical institutions divest themselves from the recommendations laid out by ACOG, period. Because as long as they adhere to this nonsensical fantasy fairy tale that is inherently damaging to women, they are not fit to serve. I trust nothing that they say in terms of scientific anything, because of how unscientific this is. Go ahead.
Yeah, that was that was brilliant. And what does that look like? There's been talk about a day of strike. A women's day of strike. Bring I'm in the UK. Bring the UK, bring the US to a standstill, because frankly, what's happening in your nation, it will become transphobia in 5 years' time. This is a global move to damage and denigrate women, to eliminate womanhood. And women will die, particularly black women will suffer. They're already suffering. I'm not going to stand for it. And what are we going to do? Are we going to strike? I think that we should.
Absolutely. I think first and foremost, we need to go to our local birth, professionals, our OBGYNs, and confront some of these things. And we've just seen Christina is, doing a fundraiser right now. For those of you seen the viral story of a woman who is, receiving care for breast cancer, a female disease. I know like some men can get, breast cancers, breast tissue, whatever, still predominantly a female disease. Okay, that affects a lot of our mothers, our grandmothers, our aunts, our sisters. It's devastating to families. And she's been discharged from care, not only from her specific, medical person, but from all of their associated facilities. She's not allowed to access oncological care. Why? Because she protested the presence of a trans inclusive flag that was held, or that was being hung, I guess, in the like lobby, or that was, in the like check-in place or whatever. And she said, I feel that, I'm really dismayed and I don't feel comfortable having that flag represented when, this is a movement that is so deleterious to the needs and the rights of women. And she was basically told that she's now discharged from care. She's not welcome back. And as somebody who had fought cancer myself, and yeah, I think Christina, if you would post the good, yeah, anyone check the chat? Christina just posted the fundraiser. It is terrifying. I just fought cancer. I'm literally right now is my 2-year anniversary from chemotherapy. It is a scary, scary time to be in. And to be discharged without like conversation, just saying go figure it out, and knowing, and especially a lot of these communities, there aren't a lot of options. I mean, so it's scary, and it's going to get worse and worse and worse. We've got to confront people, your local doulas. If you hear them talking about trans inclusionary stuff, challenge them. Post about it, blog about it, call it out. Call it out at ACOG. And I know, like I said, this is a fight. It's going to have to be a big coordinated effort of us pushing back and say, not today. No, enough. This is fucking insane. We've had enough. And I know from our end, I want to start by getting the attention of ACOG, the American College of Obstetrician Gynecologists, saying we're paying attention. You don't get just to keep getting away with this. Women were never consulted. It's always, trans people being calling things that they don't want to be called. They could kill themselves, and just so make them so sad, and we shouldn't do that. But it's like, never mind the fact that, like, you know what I mean? Like, just rip our language away from us, destroy, our experiences and our ability to communicate our experiences. We're all being shut up and shut down. My YouTube channel is on the brink of falling apart. And again, anybody who doesn't already, follow me on YouTube at A Slightly Twisted Female. I'm on suspension because I'm not allowed to speak. Go ahead, Christina.
Well, I was just going to add to that what you were saying about Marlene, because I think it's really important that we all get behind this woman, because she did what we all say that we need to do. She stood up for her gender critical beliefs, or her non-belief in this gender ideology, the new state sanctioned religion that they have imposed upon us. And she stood up to it and said, hey, I don't like this. This is degrading to women. Men cannot be women. And she wasn't even impolite in her email. If you read it, she said essentially what we all say in very plain language. And this hospital was like, oh, yeah, no, fuck you. We're not even going to treat you anymore. This lady's due for a double mastectomy at the end of the month. So we need to get behind her and like show her support. So go to her page, tell her, that you're behind her, because she's also getting shit on, because the TRAs, they're coming out saying, "Oh, I hope you die," and stuff like that to her, which is awful. And Britt, where is the ACOG? Where is that protest going to be?
Yeah, okay. So their headquarters are in Washington, D.C. And let me see. Hold on. ACOG. Let me just. Oh, let me see. ACOG. I don't have it memorized, but it's right here, Washington. All right, ACOG headquarters. Okay, so so they're headquartered in 409 12th Street Southwest, Washington, D.C. Now, right outside of their headquarters, literally like one step away, there's this little tiny park, like a rotunda park, and that's where I requested that's where I got the permit for. So it's like a great little spot, and it's within, right outside, within eyesight of them, and hopefully to cause attention. It's going to be I have it from 2 to 5 p.m. So, I don't expect that we use the full 3 hours, but, so my plan is to just start with a free speech event for women, right? Because again, since women aren't allowed to go and express their concerns without fear of retaliation, I mean, my God, retaliation, being thrown out of cancer care while you're in the throes of an aggressive disease where time is of the absolute, element. I mean, time is you've got to act quickly. You can't just, yeah, that's terrifying. So we need to speak up on her behalf, and women like her. So we're going to have a free speech for women event, similar to the Speaker's Corner in the UK, and, the Let Women Speak events that we've been having around the US. We bring a small podium, gather women, and give women a chance to speak. It'll be live streamed to my channel and Christina Goki's channel, who's in here right now. She's going to be anchoring it. I'm so excited for that. She's a great anchor. And and let women just talk about their experiences, because guess what? When we talk about these experiences online, we're shut down, we're deplatformed, we're harassed, we're attacked. So if we need to literally just stand together and get a little speaker and just physically speak, then that's what we're going to do, and call, and I'm going to, in the meantime, so anybody who would like to be a part of that action, whether you're from the US or not, whether you would be able to physically come or not, there are a lot of ways to get involved. Leading up to it, again, it's on November 3rd, so we have exactly 3 months. I want to write letters. I want, if anybody wants to be part of like a letter sending committee where we can come up with a template, write letters. I also want to be able to, notify the media. So if I have any sort of editors and things like that, I'm going to try to put together a press release. And anybody who's interested in just being a part of like a research team, once I get my channel unlocked and I can post again, I'm going to really focus in on this topic. And, whether it's exposing, like here's an example. If any of you guys want to like vomit profusely, because I know that we all enjoy doing that, go ahead and watch Dr. What is it? It's Mama Dr. Jones. She's like a pro-trans OBGYN, and she's all about like selling merch. She's just a massive grifter. And she just gives all this like crappy information, totally sells out women, for trans identified males. And we need to call out people like that. So if anybody wants to, participate in either doing research, trying to find some like peer-reviewed, published research on, some of the dangers and side effects of transition on, perinatal outcomes. I've already done a few of those videos, anybody who wants to, delve even deeper into ACOG's policies, or if, I think we should really look into what those re-education, pro-trans re-education things are. What are they teaching in those? What are they, what exactly? It's so important that we know the enemy. It's so important that we know exactly what it is that they're putting out there and that they're demanding. and speaking up. So we're going to have a speaker, a Let Women Speak, free speech for women event. And, we'll have signage. It'll be live streamed. And so far that's what we're doing. And then I want to do a letter writing campaign. And then whether it's doing like a march later or do some other like community building for the women who attend, I'll probably be there for most of the weekend. So, it's also important just that women can see that they're not alone. I think that that's what's been so powerful about these Let Women Speak events or the Turf Pride, or where you see a collection of women who come from all different, my God, a whole range of different ages. We have women who are lesbians. We have women who are, married. We have women who are mothers. We have women who are, child-free by choice, right? We have women from so many different female backgrounds, and we're all joined by this one thing, is that we are women, and we're not going to cede our identity to anybody else, and we're going to stand together. And for any woman who has tried to speak up and has been shut down or dogpiled by these TRAs, I think it's really healing to turn around and see that, no, you're not alone. No, we're here. We're tired of it too. We're going to keep getting bigger. It was like Jen talking about her experience at the Dyke March. To me, it was such an amazing uh, sort of like, revival for her to have been thrown out and kept out of the Dyke March because they wore shirts that said adult human female and talked about Stormy, who threw the first stone at Stonewall, or the first brick at Stonewall and started the Stonewall riots. Was a homosexual female. They're trying to say that she's trans. And I know that that was painful. Of course that's painful. To be thrown out of your own community, told that you're not allowed to just be literally the definition of a lesbian is a adult human, or is a female homosexual. And you're getting, but to come then a few years later and stand in the same spot, but this time surrounded by women who are kindred, women who believe what you believe and think like you do. My God, that's such a heal. I know that she was so healed from that experience. We need to do that for each other. Sorry, whoever was just requesting, you can request again. I was just about to let you in. But yeah, that's why I just think having these in-person things, and then where people can like watch and participate, but definitely donate to the Marlena Fund. We've got to support like stuff like that. We've got to really rally behind people. We've got to, and not just show the individuals that they're not alone, but we need to show these organizations who are doing this to women that we're not going to put up with it anymore. We're not going to just, passively let you bully and domineer us and destroy us and treat us like shit. We're standing the fuck up. We're saying no. These women aren't alone. If you thought she was by herself, you thought fucking wrong. She's got a whole international presence of people who are fed the fuck up and who are ready to ride out. We need to show them. You're not going to, if you think the numbers are on your side, trust and believe, baby. The tide is turning. Sentinel, go ahead.
Hi, thanks. When it comes to ACOG, and you were kind of questioning, funding and things like that, it might be worth looking into, because I know that ACOG does have ties to educational institutions, which means that some of the money that they may get is tied to Title IX. So under the revisions of Title IX, because gender is now one of the protected classes for Title IX, it can possibly directly affect some of the budget they get under federal R&D. And so if they don't comply completely with certain aspects of Title IX, if I'm correct, then that'll really damage how much money they can get to research things. And their argument could be that without that money, they can't additionally research things that do truly impact women. I'm not saying that it's right. It's really fucked up how that works. But in recently researching things like Title IX and how far-reaching that is, even outside of educational institutions, it has, and you're talking about it, it has far-reaching effect.
Absolutely, absolutely, and follow the money. Absolutely, follow the money. And it's like, I think one of the benefits of if they do have these outside pressures or these, bigger bureaucratic institutional pressures, once we start pressuring them, they might get to the point where they need to start organizing and put pressure, push back on whatever financial pressures that they're getting. So from time, yeah, send all that's 1000%. And like any involvement you would like to have, you're super welcome. We got 3 months to put this together. And so, like I said, anybody who wants to join the effort, there are so many different ways that we can all participate. And this impacts everybody. It's like, I don't care if you never want to carry a baby a day in your life and you want nothing to do with childbirth, and and all of that is totally fine. We're all impacted by this in so many ways. Men are, I mean, it's literally, it's the beginnings of families. I mean, families are the absolute cornerstone of, I mean, like, where we come into the world. Once the family unit finally falls apart, and once we hear that death knell, who comes in next? What's the next family? A family will always be there, right? A family will always be there, but who's going to take over that role? And I really believe that's what they're hoping for. They're hoping for that, schools and indoctrination centers and the government, will sort of reformulate how, children bring up. And it's, again, if you can dismantle these structures that keep us sovereign, then it's like it's free reign. Go ahead, gender.
Exactly that. And that is all within the textbooks of queer theory. They're already
I can't hear you. Can anybody else hear?
I could hear him.
sorry.
I hear him.
Or am I not hearing anything?
I think that you
I
Can
don't
you
don't
want to
hear
hear
me?
hear.
anybody.
Can you
If
hear
you
me?
can hear any of the other speakers, do a 100. And if not, do a thumbs down. Oh, why don't I hear anybody? What the fuck?
So
Sorry. All right, I'll try to figure that out.
Okay. Yeah, just while she's figuring that out. Yeah. Um, like I say, they talk about family already within those sort of circles. And it is this idea of replacing the family. And it's, like I say, I think it's connected with queer theory, the whole idea of breaking down the family structures, removing children from their real family, um, and take and imposing something else. Um, it goes back to the structures. So the whole Gramsci, why didn't communism work in the West? And he said that there were 7 pillars of culture that needed to be deconstructed in the West in order to then impose communism. And this is, I mean, I know that I probably sound like a conspiracy theorist, but this is written down in the text, and I was a left winger up until I started reading this stuff. And it goes through a list. One of those things is the family, deconstructing the family. And then there's a whole range of other structures, whether that be religion. I mean, I'm not religious at all, but that was on there. And other areas as well.
Okay, I'm sorry. I can't hear anything. So I feel so I missed everything that the speaker. Can you guys hear me? Can you guys do like a 100 if you hear me? Okay, what the I don't know. Well, it might be time to wrap up the space. But I do want to continue to have these. I think this is a conversation. This is a big undertaking. I think it just, going out and demonstrating in front of ACOG is just the beginning. I think this is so fundamentally important, again, whether or not you are a mother yourself or to become one, or, what, uh, whoops, whether or not, you have, I mean, all of us have a mother. All of us, are born of women. I mean, once these, like it all, I mean, it all feeds into transhumanism, and someone was talking about like the removal of female body parts. Well, what's going to happen to those uteruses, and what's going to happen? I think we can take some pretty educated guesses on. Artificial womb. We know that this is where this is headed, where we no longer, that way, then children have no parents at all. Then there's no family unit at all. Regardless of how you feel about the nuclear family, for babies to, be carried by a mother, to babies hear a mother's voice in utero. Babies are born responding to a mother's voice, responding to a mother's smell, because they've known those things their whole life. And their whole, time while in utero. They're also born responding to other people in the household's voice. A baby is born already knowing, if the father was in the home, knowing the father's voice, or the siblings. They're already part of the fabric of family life from before they're even born. It's are removed. It removes our humanism. We've got to fight back. This is early. This is scary. I'm scared. I'm scared. I'm scared for my daughters. I'm scared for us. I'm scared for humanity. If, the further that we let this go down a slippery slope, we must. It's going to get harder and harder to reverse course. Now is the time. Now is the time to get mad. Now is the time to gather up all of your strength, and bind together and put aside our differences. As women, some of us are lesbians. Some of us are heterosexual women. Some of us are married. Some of us are separatists. We come from such a wide range of choices and life, and some of us are men who care about the women in our lives. Wherever you come from, this matters, and we need to decide that it matters, and that we're going to do more than just retweet some tweets and bicker back and forth online. We've got to take this to the streets. We've got to stand up. So if anybody who wants to be involved in the action, like I said, follow my channel, A Slightly Twisted Female, on YouTube. I'm going to continue to, we're going to unpack this. DM me if you want to be added to the Signal group and be a part of, the planning and discussion. Everybody who came today and participated, thank you. You guys were great. Is there anything anybody else wants to say before I close this up? Or are we
Just thank
good?
you.
Go ahead,
Thank you,
Christina. I'll
Britt.
see if I can even hear you.
I just said thank you. Thank you for doing this.
Okay. Well, I don't know what you said, but I'll bet it's lovely. I'll bet it is just so lovely. I can't hear anything. I don't know what the hell is going on. I love you guys. Appreciate everything. Hit me up if you guys need anything. And I'm going to try to do this space. Maybe I'll like make it a Friday thing. I'm also going to have a Zoom call that I plan, maybe a Friday Zoom, Friday evening Zoom call, as we get closer to planning. So, yeah, it was great talking to all of you, and I will see you guys later. Goodbye.